Today, 12-month durability data for accelerated SWIFT Deep TMS in major depression. BrainsWay says over 80% of patients who got their SWIFT accelerated Deep TMS protocol for depression were still in remission 1 year later. The number is striking. The study design is not what you might assume. Here is what was actually reported and what the caveats are. SWIFT is an accelerated schedule of BrainsWay's H1-coil Deep TMS system. Standard Deep TMS for depression is one 20-minute session a day, 5 days a week, for 4 to 6 weeks. SWIFT compresses that into 5 sessions a day for 6 half-days across 2 weeks, each under 10 minutes. Same total dose, different schedule. The FDA-cleared SWIFT for major depressive disorder in September 2025. The pivotal non-inferiority trial, published in Brain Stimulation in March 2026, randomized 104 adults with moderate to severe MDD-89, completed 6 weeks of treatment. The accelerated arm hit 87.8% response and 78% remission on the Hamilton Depression Scale, statistically non-inferior to standard Deep TMS. Median time to remission was 21 days with SWIFT versus 28 with the standard schedule. Clinic visits dropped by about 70%. For residents and clinicians, the operational story matters as much as the efficacy. A patient can finish the acute course of Deep TMS in a week and a half instead of a month. Time off work, transportation, childcare, all of it compresses. That is why payers like Evernorth removed prior authorization in early 2026 and adoption is up sharply. The 12-month follow-up, presented at the Clinical TMS Society meeting on June 9, 2026, re-enrolled 65 of the 89 pivotal completers. Of those 65, over 80% were still in remission at 1 year. Severe functional impairment fell from 85% at baseline to 0 at 12 months. Fewer than 25% needed a medication change or a repeat course of TMS during the year. 3 things to hold with that headline. First, the 12-month data are preliminary, presented as a conference poster and still subject to peer review. Second, this is an open-label follow-up, not a randomized maintenance comparison. There is no sham arm and no defined retreatment schedule. Third, only 73% of the pivotal completers re-enrolled. Patients who did well are more likely to sign up for a year of follow-up. The 80% applies to that group, not to every patient who starts SWIFT. Bottom line, the SWIFT pivotal trial shows accelerated Deep TMS is non-inferior to the standard protocol at 6 weeks, and the 12-month follow-up shows most remitters stay well for a year. That is a real durability signal. It is not yet a maintenance strategy. Watch for the peer-reviewed durability paper. For questions or episode ideas, drop them below and subscribe for more psychopharmacology breakdowns. Educational purposes only, not a substitute for clinical judgment.